Welcome to this week's edition of Cardiovascular Updates, covering the latest breakthroughs. Brought to you by LucidQuest, the American College of Cardiology and the American Heart Association have issued their 2025 guidelines for hypertension management, giving renal denervation a Class IIb recommendation. The ultrasound-based Paradise system and the radiofrequency-based Simplicity Spiral are both FDA-approved, and national coverage may be finalized by CMS as early as October 2025. The updated approach emphasizes personalized care and risk estimation using AHA's Prevent tool. ETH Zurich has introduced a groundbreaking innovation in cardiac repair, a 3D printed, biodegradable heart patch known as RC patch. The scaffold, infused with hydrogel and lab-grown heart cells, integrates into heart tissue and naturally degrades over time. Early animal studies show rapid control of bleeding in a pig model, marking a significant step forward in regenerative medicine. Cardiovascular technologies are leading innovation across the FDA's Breakthrough Devices program. Of 1,176 designations to date, 243 have gone to cardiovascular devices. Noteworthy advancements include the TriClip G4, Farapulse, Tendyne, and Echo's ELEF tool. These technologies aim to accelerate care for critical and underserved conditions. In stroke prevention for patients with atrial fibrillation, the addition of biomarkers such as NT-proBNP and GDF15 to the CHA2DS2 VASC model has shown improved predictive power. A 12-year cohort analysis involving over 30,000 adults suggests this approach could refine anticoagulation decisions and improve long-term outcomes. Boston Scientific has launched the Agent DCB Stance trial. With more than 1,600 participants, the study investigates the Agent drug-coated balloon for treating de novo coronary lesions, particularly bifurcations and long lesions. The goal? Establishing a stent-free alternative for complex anatomies. Environmental health intersects with cardiovascular care in a new study on air quality. HEPA air filter use among individuals living near highways led to a reduction of 3 millimeters of mercury in systolic blood pressure. The study links traffic-related air pollution to sympathetic nervous system overactivity and highlights the potential of simple, low-cost interventions to improve cardiovascular outcomes. Merck will present significant cardiovascular data at the European Society of Cardiology Congress 2025. The company's pipeline spans atherosclerotic cardiovascular disease, pulmonary arterial hypertension, and heart failure with reduced ejection fraction. Key therapies include Winrevair, also known as sotatercept, and Verquvo or vericiguat. Results from the Zenith, Cadence, and Victor trials will be shared. The FDA has expanded the approved use of Repatha. The PCSK9 inhibitor is now indicated for adults at increased risk of major adverse cardiovascular events, regardless of prior diagnosis. It's also approved as monotherapy for patients with homozygous familial hypercholesterolemia. Repatha's updated label is supported by clinical data from over 57,000 patients. New data on atrioventricular interval management, or AVIM therapy, shows encouraging results in hypertensive patients with pacemakers. Pressure volume loop studies reveal systolic blood pressure reductions between 17 and 19 millimeters of mercury, depending on pacing strategy. The therapy may promote reverse left ventricular remodeling without compromising cardiac output. Finally, Japan has approved the Paradise Renal Denervation system for patients with resistant hypertension. The device, which delivers ultrasound energy via a hydro-cooling catheter, is the first of its kind to be approved in Japan. The decision is based on outcomes from the Radiance HTN TRIO trial, and it signals continued global adoption following earlier approvals in the United States and the European Union. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare